Today we shall talk about how to do assessment for oral mucosal lesions. In our clinical practice, we encounter a lot of oral mucosal lesions as they are common. They can be due to physiologic changes or a local disease. They may also be an oral manifestation of a skin disease or an adverse drug reaction or a systemic disease, for example, gastrointestinal disease. To manage an oral mucosal disease successfully, we require an accurate diagnosis. Now the question arises, how will we get an accurate diagnosis? The correct answer is by a thorough assessment of oral mucosa for a lesion. Assessment for an oral mucosal lesion involves taking a full patient history. This includes a medication history too. Afterwards, we need to perform a thorough extraoral and intraoral examination and diagnostic investigation where appropriate. During the entire period of assessment, we should have a high index of suspicion for oral cancer. To recognize oral cancer, one should be familiar with the risk factors for oral cancer. You can consult the website of the Academy of Dental Knowledge for oral cancer topics to know about risk factors. You should also thoroughly know the red flag features of oral cancer. If any of the red flag features are present, or the diagnosis is not clear, or the patient has not responded to initial treatment, early referral to an appropriate specialist is required. An oral medicine specialist is the most appropriate specialist to diagnose and manage oral mucosal disease. But if it is not available, an oral surgeon or a dermatologist or an ENT expert will be the second option. At this juncture, it is prudent to enumerate the features of potentially malignant disease. These are induration, ulceration with rolled margins, fixation to underlying tissues, lesions present at the high-risk sites, for example, lateral border of the tongue or floor of the mouth. Now I shall tell you about red flag features of oral mucosal disease. The first red flag feature is oral ulcers that have lasted for more than 2 weeks. The second red flag feature is oral ulcer that recur. The third red flag feature is non-traumatic oral ulcer in children. The fourth red flag feature is pigmented lesion on the oral mucosa. The fifth red flag feature is red, white or mixed red and white lesions on the oral mucosa of unknown origin or with features of potentially malignant disease. The sixth red flag feature is facial or oral paresthesia. The seventh red flag feature is persistent oral mucosal discomfort with no clear etiology. The eighth red flag feature is lumps or swellings including lymphadenopathy. The ninth red flag feature is swelling, pain or blockage of salivary gland suggestive of salivary gland disease. The 10th red flag feature is suspected allergy or adverse reaction to dental materials. For example, oral lichenoid lesion, dry mouth that is not adequately relieved with artificial salivary products, and non-pharmacological methods or dry mouth caused by systemic disease. The 11th red flag feature is suspected oral manifestation of systemic disease, for example, syphilis, Behçet syndrome, HIV, inflammatory bowel disease, lichen planus, and pemphigoid. The 12th red flag feature is lesions occurring in immunocompromised patients, for example, patients with neutropenia or HIV infection. These were the red flag features for oral cancer. You must know the details of each one. To know more about each topic, you can go to the concerned topic present at the website of the Academy of Dental Knowledge. Some oral mucosal diseases are associated with significant morbidity and mortality, particularly oral potentially malignant disorders and oral cancers. Oral potentially malignant disorders include oral leukoplakia, oral erythroplakia, chronic hyperplastic candidiasis, actinic cheilitis, oral lichen planus, oral submucous fibrosis, discoid lupus erythematosus, disc keratosis congenita, and epidermolysis bullosa. Remember these names as you may need them while making differential diagnosis of an oral disease during Viva Voce in part 2 of the Australian Dental Council examination or the overseas registration examination conducted by General Dental Council of United Kingdom. Oral potentially malignant disorders can become malignant at the site of the lesion. You should also be ready to predict an increased risk of oral cancer at other sites in the mouth even when the oral mucosa is clinically normal looking. The condition I am about to tell you can be managed in general practice provided that there are no red flag features present. These conditions are recurrent aphthous ulcerative disease, traumatic oral ulcers, oral candidiasis, angular cheilitis, oral mucocutaneous herpes simplex virus, dry mouth, oral mucositis, amalgam tattoo, geographic tongue, and hairy tongue. There are physiological causes of oral mucosal discolorations, for example, 𝗿𝗁𝗔 spots, which are ectopic sebaceous glands, and leukodema, which do not require active management. To conclude, I'll say that to assess the oral mucosal lesion, you should take a proper history, including medication history. You should perform a thorough extraoral and intraoral examination, do necessary diagnostic investigations. Be highly suspicious of any oral cancer. You should know the risk factors and red flag features of oral cancer. Refer a patient to a specialist for confirmation of diagnosis and appropriate management. This is the end of the presentation. To practice scenario-based questions, you can opt for a suitable course available at the Academy of Dental Knowledge. I suggest that you subscribe to this channel so that you get the information about the release of the new videos immediately. You please share this video with your friends and known ones who are interested in oral mucosal diseases. I would be thankful if you like this video and help us grow.